Hello everyone, I am Dr. 𝐂𝐸𝐴. So as we all know, monsoons have receded and now winter is definitely knocking on our doors. So although we do not face very harsh winters in cities like Bombay, but we need to be aware about certain conditions which do worsen during this kind of a season, where the weather gets a little colder. Winter brings with it a lot of festivities like Diwali and Christmas, but the weather changes do influence certain health problems and we need to be aware and know how to deal with them. So today I am here to discuss all these points with you. So certain conditions which we face commonly in the winters is increase in the incidence of viral infections like common cold, flu or influenza as we know it. The dense air and the cold weather does help to play a part in increasing the chances of catching viral infections. So what can we do to prevent them? You usually get good amount of citrus fruits like oranges or mosambis in this season, which will help you to increase your vitamin C level and help to boost your immunity. Also follow common personal hygienic practices like washing hands regularly, covering your mouth and nose when you're sneezing, coughing. Keep a little distance from people who are sick. This will help to prevent spread of respiratory infections. The second thing which we notice commonly in the winters is increase in breathing difficulties or respiratory problems. So people who have history of asthma, COPD need to be a little more conscious or aware about this in the winters because the seasonal changes may influence and increase the chances of respiratory exacerbations. Follow your doctor's advice, continue to use your nebulizers and avoid polluted environment because in these conditions you would have seen a lot of smog accumulating all over Bombay. So these are the risk factors which you need to be aware of. During Diwali we burst crackers, but we need to keep in mind that it increases the pollution levels further. So people with respiratory problems need to avoid all these environments. The third and very commonly seen problems in winters is that people who are at risk for heart disease, stroke, the chances of a thrombus or a clot forming in the arteries or veins increases in a cold environment because it induces a prothrombotic state. So we do notice an increased incidence of heart attacks and stroke during the winter seasons or winter months as compared to summers. So if you are experiencing symptoms of heart disease like chest pain or breathlessness, do get a ECG, consult your cardiologist and get yourself checked at the hospital at the nearest. Keep your diet in a well-balanced manner, do regular exercise, avoid polluted environments. That's the best we can do to protect ourselves in winters. Thank you.